Hello friends, today I'm going to talk about speech and language disorders in children and like a scope of practice of a speech language therapist. I'm RC registered senior audiologist and speech therapist and currently looking at the best speech therapy and hearing aid center, mithanpura, muzaffarpur. So who are a speech language pathologists? So basically a speech language pathologist are those professionals who diagnose and treat, and they also help to prevent disorders related to speech, language, cognitive communication, voice, swallowing, and fluency. So most of the time, the professional who practice speech language pathologist are also can also work as an audiologist. So who are audiologists? Audiologists are hearing healthcare professionals who specializes in the diagnosis and treatment of hearing loss and balance disorder. So we deals with the patients with hearing loss as well as balance issues, because our inner ear is responsible for hearing as well as balance. So we work like to we actually diagnose and treat the patients with hearing loss as well as balance disorder. So if we see the list of disabilities covered under Right of Person with Disabilities Act 2016, so there are some speech and speech and language disorder can be considered as a disability, as well as specific learning disabilities comes under RPWD Act. And now with this particular act, even autism spectrum disorder, mental illness, intellectual disability, muscular dystrophy, cerebral palsy, these all comes under right of person with disability, and they all come under like they can be considered as disabled. Now, a speech language disability and learning disability added in the list of disability category 2019. So now a speech and language disorder can be considered as disability. So if we see the prevalence of a speech and language disorder, so a study done in US, and they found 7.7% children may have speech language and swallowing issues. A study done in Canada shows that almost 8.8% children may have speech and language issues. We can see that like the prevalence of speech and language issue range between 8 to 9%. There is a study done in India by Kondat et al, and it shows like almost 9.42% of uh, children, 9.42% children may have a speech and language disorder. There is another study in India that's done by Sindhu et al, which shows that almost 6.2% of children may have a language delay. So you can see that almost 7 to 9% children may have speech and language disorder. So that's a big number. So in every 100 kids, there can be a chance that 7 to 9 kids may have speech and language issues. So a speech language pathologist uh, deals with speech disorder as well as language disorder. So let's see language disorder. So language disorder can be a receptive language delay, or it can be expressive language delay, or it can be both. When I talk about receptive language delay means if a child fails to understand commands, the child fails to understand the the instructions given by parents. So that can be that in that case we can say receptive language delay. And expressive language delay means if the child fails to express his thought in front of other, in that case we consider them as expressive language delay. So there are many kids with autism, intellectual deficit, specific language impairment, childhood aphasia, hearing impairment, delayed speech and language may have uh, can have receptive as well as expressive language delay. So what are the common features of language disorder? So they may have problem in expressing their thoughts or understanding the commands or instruction by the parents. They may fail to speak. In that case, we consider them it as language disorder. So now let's see something called articulation disorder. Articulation disorder means that's called speech sound disorders. In this, child may have trouble in saying different sounds, and child may not able to speak clearly, and it can be difficult for others to understand. May parents There can be chance that parents may understand the child's speech, but it will be difficult for a stranger to understand the same thing. So, for example, cow, the child may say cow. There is another disorder called stuttering. Commonly, we say it is stammering. In that, child may repeat a sound or maybe a complete word, or it can be a phrase. Like, for example, if the child want to say pen, the child may say pop 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 pen. The child may want to say dog, the child may say da 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 dog. So in that case, again, a speech therapist can help a child with such problem. There is another called childhood apraxia of speech that can happen, that can be caused by damage to the brain, especially in the posterior parietal cortex, in which the child may find difficulty with motor planning. So whenever we speak, whenever we speak, at that time there is a lots of motor planning that happens in our Broca's area, and that helps us to speak. But in childhood apraxia of speech, there can be a problem in motor planning, and that can lead to a poor speech, or you can say or you can say unclear speech. So a speech language pathologist diagnose the condition, and then they start the treatment process. There is another condition called dysarthria, where you can find a muscle weakness, especially muscles like the articulator, the movement of articulator, the functioning of articulators may get affected. When I'm saying articulators, that means our lips, tongue, teeth. These are articulators which helps us while speaking. But when there is a weakness in these articulators, that can lead to a poor speech or unclear speech, and this condition is called dysarthria. So again, a speech language pathologist diagnose the condition, and they start the treatment. Children with cleft lip and palate. So some children who have cleft lip, or some children may have cleft palate, or may have both cleft lip and palate. So those conditions that you may find nasal kind of a speech. So there will be a lot of nasalization in their speech. So such condition will so first of all, maxillofacial surgeon uh, maxillofacial surgeon do the surgery, and they correct the structural portion, and then a speech language pathologist helps the kid in to improve their overall communication skill, or you can say to enhance the quality of speech. There is another disorder called attention deficit hyperactive disorder called ADHD. Again, it's a brain disorder, and that leads to speech and language issues. Learning disability can also be the possibility. So as a speech language pathologist also helps the kids with learning disability, the kids who have problem in reading and writing. So almost 8 to 10% of children comes under uh, this kind of category, learning disability. So again, a speech language pathologist diagnose the condition, and they treat the condition. Many children may have problem in voice. So like they may have a hoarse or harsh voice. So again, a speech language pathologist, or you can say a voice therapist, both are same. They may help you in the treatment, in the diagnosis and the treatment of voice disorder. So first of all, we do a diagnosis, and there we find it's a kind of like hoarse voice or harsh voice, or it's a breathy voice, and then we try to find the cause of the problem, and after that we start voice therapy for those kids, and we try to help them, and we try to enhance the quality of voice in these kids. So we also work with the children with autism, intellectual deficit, cerebral palsy, misarticulation, as I already mentioned in my previous slides. So if you find any difficulty in your child's speech, you must consult a speech language pathologist without delay. In that case, don't totally rely on the advice of pediatrician. They may say you like, okay, you can wait for some time, and then you can if then you can start a speech therapy. But waiting is something like not not good in terms of speech language treatment.